Good morning, good afternoon, good evening to all my Edu Skills family members. First of all, I am thankful to the Lord Almighty for this wonderful platform. And I would like to thank our mentor, Father Dr. Salim Joseph. We really appreciate you for taking the time to share your insight and your experiences. We are really grateful for your leadership. Thank you, Father. And then our founder, admin, Soumya Sham ma'am. Thank you, ma'am, for your contributions. We appreciate your leadership and the work you do for us. I extended my thanks to the admin panel for all your hard work and dedication. We appreciate your effort and keeping things moving smoothly. Move on to the session. I would like to call Minnie Jackson for the introduction part.
Good evening, Father, admins, and all the aspirants who are joining today. And I am Minnie Jackson, one of the OET aspirant in Edu Skills. I would like to express my gratitude to the all family for giving us the chance to prepare our discussion for the listening part A. And I will move to the next portion, that is the introduction portion. Under the introduction part, we know that the 42 questions will be there. Then there is the three parts will be there under for A, B, and C. Okay. Under the A part, we have a 20 questions we have to complete within the 3 minutes. According to the father strategy, we need to focus on the A grade. The next, what are the things we need to focus on the listening part. Here we can see that the two consultations will be there. That is related to the professional and any kind of the professionals will be there or the patients will be there. Okay, then here that is according to the cardiologist or pediatrician, someone will be there, and the other side of patient or a family member will be there. Okay, but we need to focus on the from the side of the patient. Okay, then here next we need to see the patient name first. Okay, then who is speaking to whom. Okay, that means who will going to talk with the whom. That means the pediatrician is talking to the mother or whom, so that we need to get a clarity. Then what are the strategies we need to focus on? That is the patient led dialogue will be there. That is most of the answers will come from the patient side. Then look at the context. That is, knowing the context is very important so that we can understand what type of the conversation is going to happen there. The next one is the 30 seconds to read the questions before the audio begins with the beep sound. Then that is a golden 30 seconds need to predict or anticipate or foreseeing the answer. That is, look for the words before and after the gap. Okay, that means according to the father strategy, there is a one method is there, that is the first method. First method, F for the pausing, I for the investigating or inquiry, R for reading, or S for the speaking out, then teleprinting or writing. This same method, first method, we can use it is applicable for the reading and listening also. Then next one is write the exact word or phrase as given in the audio. What the audio we are hearing, the same word we need to write. No need to write any paraphrasing or synonymous word what according to our knowledge, but you have to write only the word what you are hearing. Then there is a typos is there. That means a minor smelly mistake or accept pronunciation should be correct and the meaning also should be correct. Then listening strategy, as already I mentioned, that is the prediction or anticipation. Then we are of the paraphrasing. Then we are of the synonyms and we are of the collective words. The next one, listening for what are the things we need to focus. Then we have to listen for according to the patient condition. We need to focus that body parts or where it is affected. Okay, then adjectives is there. Then names, that is a medical condition or medicine's name or medication treatment will be there. Then the symptoms, okay, different type of symptoms related to the one conditions can get. The negative expressions also will be there, and sequential expression or time expression we have to see. Then next one is a cause and effect. Okay, that is an example on the medication overdose. Okay, patient is taking the overdose medication, that is the cause, and the effect will be the dose reaction or the patient can get some other symptoms also. Then next one is the procedure. Here we can predict that some kind of the on ultrasound, X-rays, and the ECG. Okay, any kind of the procedures what they will go on to do according to the patient, we have to predict. The next one is on the infirmities or the daily activities that is related to the patient activities, maybe the diet or lifestyle changes. Okay, so that also their maybe smoking habit or drinking habit, or whatever the things they will going to say, we need to focus. Then next one is the assumption. We need to predict that what is the exact things. Okay, we'll move to the first questions. Okay, extract one. The question will be there is a you can see that this is a contest. You hear a pediatrician talking to a mother of 6 years old boy called Daniel. Okay, for the question one to talk, complete the notes with a word or short phrase that you hear. And you now here we have the 30 seconds to look at the notes. Okay, this is the descriptions given in the first. You need to understand that who is going to talk with the okay, that is a pediatrician here and the mother of the Daniel. Okay, 6 years old boy. Okay. The next it's again it's given the patient name, it's highlighted, that is a Daniel Lemming, 6 years old. Then under that there is given the description of the physical complaint. That means whenever you go on to see the description, you have to focus on the side headings or the sub headings. Here, first heading is a description of the physical complaint. Then that means here the mother is going to tell the problems is happening with her son. Okay, here skin on Daniel hands is both. Okay, so that means what is that? Both, that is the keyword is used. Okay, maybe some kind of the disease condition or some symptoms or signs is predicted that. Okay, then next question, Daniel pain described as. Described means we know that this is the nature of the pain or the pain, how it is affecting. Then next one, following that there is no itching or scratching is there, but occasionally the baby is getting that some accompanied by something, that is a blisters or bleeding or something is getting. So mother is anxious about the something, if she want to say the things. Okay. Next slide, we can see that the description is given and the answer also is there. Okay, see first line in the text, skin on the Daniel hands is both. Okay, answer will be this cracked and dry. Okay, here that is a clue. Maybe two symptoms will be there. What is the exact problem is happening? Audio. Say here a description is given for the and we're going to see the script. Okay, in the text it's given well, skin on the Daniel's hands is both. Okay, so clue we can, that is a maybe with the two symptoms. What is the exact problems happening? We need to focus. Then audio, we can see the here that well, it's the his hand. They are really bad shape. It's mainly the skin, the way it's look. Okay, it's so cracked and dry. Okay, the answer will be the cracked and dry because both answers both given. So you need to write both answer. If you're going to write only one answer, we'll got the loose mark. Okay. Then second one, text in according to the text, Daniel's pain is described as. Okay, that is the clue nature of the pain. Then audio, he is reluctant to complain about it, but I have managed to get him to tell me what it does hurt. From what he says, I believe the pain is pretty much constant. Okay, answer will be the constant. The here we can see that is a contrast word is used. Okay, that is a but. Then answer pretty much constant. Pain described as a constant pain is there continuously. Baby is getting the pain. Okay. Then next one is the third one. Occasionally accompanied by something or some other conditions is along with that. Okay, that means the mother is telling is a well. Yes, although there is no itching or anything like that, I mean, I have never seen him scratching them. But the most worrying thing is that there is a even bleeding sometimes. I just don't know, understand how they are got so bad. Okay, here answer will be the bleeding. Sometimes combined, occasionally, synonym is given sometimes, and the scale is used most and never. Then either contrast word is used although, and but also is there. Okay, three answer, that is the first one cracked and dry, second one is a constant, and third one is the bleeding. I hope it's clear. If you have any doubt, you can ask me. I'm sorry for the interruption in between.
So, Kimini, thank you for your explanation, and it was a nice PPT.
I welcome Annie to present the next part. 4, 5, 6 questions will be described by Annie.
Thank you, ma'am. I am Anjos, one of the OET aspirants from Edu Skills International. First of all, I would like to say my sincere thanks to Father Salim Joseph and all admin panel members for your constant support and guidance. Today, I will discuss about question number 4, 5, and 6. As we know that the conversation takes place between Daniel's mother and pediatrician. So, question number 4 and 5 comes under description of physical complaint. Question number 4. Daniel's condition began last dash. So here we need to predict some year, days, some months like that. So we need to listen for time or season. In that audio, in the script, we can see that the pediatrician asked, "So when did this all begin?" So the mother replied, "Oh, it's been months now. I thought it would be clear up in the spring when the weather got warm because I initially put it down to that cold snap we had last winter." So here the answer is winter. And also here we can see that the initially this is a sequential expression is being used here. Then question number 5. Daniel's symptoms worsened by. So here also we can predict it may be due to some procedure or activity. So in the script, in the audio we can see that the mother said, "I have tried to pin down what set it's off, and the thing I keep coming back to is all the hand washing. It make it worse." So here the answer is hand washing. Hand washing causes this Daniel symptom worsened by hand washing. On question number 6, treating with dash. Here also we can predict that the patient is using some kind of medication or cream. This question comes under treatments already tried. Here we can see that the patient tried some over-the-counter remedies, home remedies, and wearing silk gloves at night. So here we need to assume for some kind of treatment. In the audio, we can see that he was the mother. The pediatrician asked, "Have you tried any treatments?" Then the mother said he was okay with the petroleum jelly treatment though. So that's one of the things that we still use now. So here the answer is petroleum jelly. Thank you all. Happy learning.
Okay, Anit, thank you for the explanation. So we'll move to question number 7, 8, and 9. So welcome, Nitya. You can continue.
Good evening, all. Good evening, Father, and all our admin panel members. And first of all, I would like to say thank you, our Father, and all admin panel members for giving this such a wonderful opportunity for to improve our learning as well as our skills. Today, I am going to deal with number listening part A, question number 7, 8, and 9. 7, 8 comes under the treatment already tried. The subheading is the treatment already tried. First question is uses his sister's dash. When we see the question, we have to underline the hedging word. In this question, the hedging word is uses his sisters. After that, we have to foresee the answer. And what might be the answer? Uses his sisters. This question especially comes under the treatment already tried. So we have to assume that it might be related to some tablet or ointment, some whatever might be, we have to assume like that and keep it in our mind. And then move to the next question. Seems to improve during the dash. And the main hedging word of this question is improve during. And during means it will occur some period of time, and we have to predict it might be in some sort of time, and we have to keep it in our mind. And next move to the next question. And the side heading of the next question is background information. And we have to read the next question. The patient described Daniel character as, and this question is completely related to his behavior. That means the answer might be dealing with his behavior. That means the Daniel character, and we have to underline the hedging word and then move to the script. The script related to the seventh question is, I'm going to read. But also his older sister Sarah has eczema. So another thing we are doing is using Sarah's aqueous cream. Sarah doesn't mind, but Daniel hates using his sister's stuff. In our question, we have use his sisters. That is the keyword in our question. In the script, they are telling sister is Sarah. And in the first sentence, they are telling his older sister Sarah has eczema. Then sister is Sarah. The next sentence, they are telling. So another thing we are doing is using Sarah's aqueous cream. That is Sarah's aqueous cream. Then the words are similar. Using is also there in script as well as the question. And the sister is also there in script as well as question. So from these words we can identify if the answer is aqueous cream. Then when we move to the next question, script of the question, some weeks are better than others. Like for instance, during the school days, there is a definite improvement then. In that, what we can understand, our eighth question is improve during. Something is improved during particular period. And in the script, they are telling, like for instance, during the school days, and there is a definite improvement. That improvement word is also in question as well as in script also. Then we can easily identify the answer is school days. Okay. Then when we move to the next portion of the script, we can see that he is well at school, but his teachers have alluded to the fact that he is highly strung. And our question tells the people describes Daniel character as dash. And in the script, they are telling his teachers have alluded to the fact that he is highly strung. It is indirectly given. His teacher is telling he is highly strung, but in the question, it is telling Daniel's character. So, but the contrast word but is started from the sentence, and we can identify, and we can think that the answer is somewhere near the contrast word, and it is indirectly given. The answer is highly strung. Okay, the answer of these three questions is, the seventh question is use his sister's dash. The answer is aqueous cream. And eighth question seems to improve during the school days. In the script, in the slide, it is written PPT. It is also written only holidays. Sorry, it is mistake. The answer is school days, school holidays. Then the next one is people describe Daniel character as highly strung is the answer. Okay, I hope all of you understood. Thank you, everyone.
Thank you,
Thank you,
Nitya.
Nitya.
Next part will be done by Manu. I welcome Manu to present last part.
Good evening, everyone. Okay, today I was given question number 10, 11, and 12 to explain. So, what we people do, we generally mark the keywords, right? So, here in this 10th question, we can see the keyword when after this hard to handle. So, Daniel has tantrums, finds any dash hard to handle. Next line, Daniel is overly worried about dash on his food. So, we can take these two words as keywords. Overly worried about on his food. Next, we are moving to the next head subheading, mother's concern. So it's what's her mother's concern. So when on seeing this subheading, we can see that so something is going to come out of her mother's mouth. In this one, we can see the keyword. She worries. He may be developing. May what does may tell some possibilities. So maybe developing. So most probably the answer here will be, we can make a guess, some disease condition, right? Yeah. Now actually I prepared the audio that was sent by Helen ma'am. Let me play it.
he's doing well at school, but his teachers have alluded to the fact that he's highly strung. That's definitely how I'd sum him up too. Take, for example, his tantrums. Last week, all hell broke loose because he had to go to the childminder on a different day. He spent the whole 3 hours there crying his eyes out. And this is a lady who's looked after him since he was 5 months old, so it's not like he doesn't know who she is.
Right. So he finds it hard to cope with change. Is that a fair assessment?
Well, yes, but it's not just that. When we go on a family day out, I now have to wrap all of his food in plastic cling film or he just won't eat it. He's convinced it'll have germs on it. Honestly, it's just making things impossible.
So what are your main concerns?
Well, I've done a fair bit of reading up on this, and that's why I wanted to come to see you by myself at first. I've heard about conditions such as Asperger's, but I don't honestly think it's that. What I am worried about is the possibility that this could be OCD, or at least the...
Here I have given the keyword in a yellow shade. It's hard to cope. The next is the answer. Change. And for the next question, 11th question. So here the answer is germs. Here we can read in the sentence saying that he convinced it have germs on it. So what does it here? It here tells us it means his food. So here the food, then answer comes germs. And the last question we can see that mother's concern. She's worried he may be developing. In the script, we can see may is related to could, right?
Could.
Could. So worried about is the possibility that this could be OCD. So worries to be developing. The answer is OCD.
OCD.
We can see the could make the answers. The answer, the 10th answer is change, and the 11th one is germs, and the 12th one is OCD.
Okay, Manu, it was really good. You worked really hard. That we
Yes,
can see.
madam.
Yeah.
We appreciate
Actually, I
your
worked
great
today.
effort.